Welcome to another edition of the Ministry of Health's Weekend Review. Last Sunday, the Honorable Minister of Health, Dr. Frank Anthony, participated in the annual Kidney Awareness Run from the Bank of Guyana Avenue of the Republic to the Seawall Bandstand in Kingston. Thereafter, Dr. Anthony attended a continuing medical education session on the cervical cancer elimination. The session focused on formulating a robust strategy to address cervical cancer and ensuring optimal care for women is at every level of the healthcare across Guyana. Minister Anthony, during his feature address, emphasized the importance of preventing cervical cancer through HPV vaccine. He used the opportunity to announce the government's plan to roll out free HPV testing to all eligible women.
This morning, the focus would be, first of all, in cervical cancer. And we want to look at that continuum. So starting with prevention, we have a very effective tool that is available to us to prevent cervical cancer. But unfortunately, we don't use it very well. And so while Dr. Lal was talking about advocating, this is something that I also want the physicians here to start talking to their patients more about, and that is the HPV vaccine.
Meanwhile, on Tuesday, Minister Anthony delivered remarks at the launch of the National Mental Health Action Plan and Suicide Prevention Plan for Guyana spanning from 2024 to 2030. Funded by the European Union and supported by PAHO WHO, this plan aims to enhance community-level mental health services and provide comprehensive care aligned with the national and international frameworks. It builds upon previous evaluations, involves local stakeholders, and aligns with relevant legislation and global goals. The plan focuses on mental health services while acknowledging separate plan for suicide prevention and substance use control. According to Dr. Anthony, this strategy document addresses substance abuse, an aspect previously overlooked.
One of the things that you will see in the new action plan was an area that we hadn't paid a lot of attention to, and that is the area of substance abuse. We felt that this is something that we need to pay more attention to. And while from the ministry side we have about 10 clinics where we're working with people who abuse substances, we want this to be expanded. The ministry also helped to fund two of the more prominent non-governmental organizations that work with people who abuse substances, and that is the Salvation Army and the Phoenix Recovery. But we are also looking for more partners on how we can do this, and this is very important to us.
Additionally, Assistant Director of PAHO WHO, Dr. Seeley Thomas, stated that the action plan aims to promote the advantages of multi-sectorial collaboration, enabling various sectors and stakeholders to combine their financial resources, expertise, and capabilities to ensure successful implementation. On Wednesday afternoon, Dr. Anthony commissioned the first simulation laboratory at the Lethem Regional Hospital in Region 9. This facility will support students in the hybrid professional nursing and nursing assistant programs, offering hands-on experience managed by the region's registered nurse, Deshauna Mentis. The lab will enhance clinical skills and patient care quality through simulations and modern equipment. On the said day, we officially launched the Medical Laboratory Technicians Program, the first of its kind in the region. Another batch of Community Health Workers program was also launched. On Friday, the ministry's Chronic Disease Unit officially launched its strategy for elimination of cervical cancer 2024 to 2030. We will be bringing you more details on this next week. And this has brought us to the end of this weekend review. Until next time, stay safe and protected.